Alrighty, so it's 12:03, so we're going to get started with today's webinar on source control and PPE, a quick refresher training. Before we get into anything, I just wanted to take a moment to go over our continuing education criteria for those of you who are attending to receive CNE credit. So this is a 30-minute session that is approved as a nursing continuing professional development activity by the Northeast Multi-State Division Education Unit as an accredited approver by the American Nurses Credentialing Center's Commission on Accreditation. This is the second part of the two-part series, each 30 minutes long, which you'll then get one CNE credit after all is said and done. So in order to receive your CNE credit, these 4 steps must be completed. Step 1, if you haven't done so, and if I don't already sound like a broken record, please complete the pre-session survey prior to the start of the training. My colleague Abby will put it into the chat box once again if you need to access it. So go ahead and do so because this does close at the start of the training. Second step is to attend this live. So we're all here. Welcome. Third step, you must complete the post-session survey after this training ends, and the post-session survey will be emailed to you tomorrow. And then the fourth step, you must complete the post-session quiz, and a link to the quiz will also be emailed to you tomorrow. So this training, like I said, is part of the 2-session series, and you must have attended that first part titled Standard Precautions and Hand Hygiene on August 8th if you are looking to receive the CNE credit. And this is just specific to receiving the CNE credit. For other healthcare colleagues here today who are opting for certificates of training, EMS continuing education, and dental IPC continuing education, items 1 through 3 are required, while number 4, the post-session quiz, is optional. Hopefully that's clear, but if you do have any questions, please feel free to reach out to our team. So now that some of our front of the house stuff is completed, I wanted to thank you for having me to lead our training. Again, my name is Allison Thurber, and I'm a nurse at the Rhode Island Department of Health and a training liaison for Project Firstline Rhode Island. So today you've joined me to discuss 2 very important infection control prevention strategies, source control and personal protective equipment. We'll dive in together to explore how these 2 strategies help to stop infection at the source in healthcare. I'm very happy to be with you today, and I hope that throughout this presentation, you all take the opportunity to engage and share your experiences and knowledge with your fellow colleagues. So for today's agenda, we will start with our welcome and introductions, and then we will discuss what source control is, how to practice source control in healthcare settings too. Then we will discuss what PPE is and how to appropriately and effectively don and doff or put on and remove that PPE. Then we will go over our key takeaways, summarize everything, go over some announcements, end of session feedback, and our live Q&A. So a few other housekeeping things as well. Please reserve the chat box for any interactions you have with our Project Firstline staff or your other colleagues on the call. If you're answering any questions or anything like that. For specific questions to the Q&A that you want answered at the end of the Q&A, put those into the Q&A box. So you have a taskbar either at the bottom of your screen or the top of your screen. Wherever that taskbar is, you should see something that says chat and then something that says Q&A. So again, Q&A, any questions that you have that you want answered, put those into the Q&A box, and the chat box reserved for interactions, adding your email, things like that. So let's get started. Session objectives: to understand the importance source control plays in preventing infection, understand the difference between source control and respiratory protection, be able to critically apply source control to the workplace, understand the critical role PPE plays in infection prevention, understand when and why PPE is indicated, and be able to don and doff, put on and take off PPE in the correct order to avoid contamination. So here we'll start with source control. So source control keeps germs from spreading by stopping them at their source. Source control for COVID-19, for example, focuses on covering the nose and mouth with a mask to keep respiratory droplets out of the air from infecting others. Another example of source control, for example, for a wound, could include a dressing so that the wound drainage or blood doesn't expose others to infectious body fluids. So perhaps the most common form of source control that we all think of is a mask. But what other methods of source control can you think of that you've used in your practice? It may help to first think of an infectious organism and then kind of think backwards. So how would you stop that infectious organism from spreading if you had it, or if you were giving care to a patient who had it? And if you feel comfortable, you can share your experience in the chat box. Again, what are some different methods of source control for infectious diseases? Gowns, hand washing, goggles. Yep. So those are all like PPE and ways to protect. A specific example might be, and it's in the forefront of my mind, but when we were first having the outbreaks of Mpox, we would ask folks to cover their pox so that if there was contact, it would minimize that. So you're covering the source of the infection. So COVID-19 has already come up a few times. And the reason for that is that many of us, or at least myself, for the first time, this was when I first knowingly practiced source control, or at least put a term to what I was doing, put a term to my actions. So why is source control particularly important with viruses like SARS-CoV-2? Someone said to reduce the spread. So absolutely. And more specifically, reduce the spread of asymptomatic transmission. So we don't always know who's infected because people can be infected and not show any symptoms at all. And that's what's being called asymptomatic. So this matters because the virus can still spread from someone who is infected but doesn't know or feel that they are sick. And that's why source control was so important during SARS-CoV-2. So when it comes to wearing a mask, your mask should fit well, without gaps at the edges, and cover your mouth and nose. This makes it less likely that your respiratory droplets can reach people and things around you, as well as makes it a source of protection for yourself. So during COVID-19, many places had mask mandates, as we all recall, which was in part respiratory protection for ourselves in public spaces, but mostly it was for source control, for those asymptomatic people that were out in public that could carry and shed the virus, that didn't know they had it and could spread it to other people. So what is the difference between what we call respiratory protection and what we call source control? So respiratory protection, this includes respirators like N95s that remove particles from inhaled air through a filter media. So when used correctly, respirators are highly effective at reducing exposure to bacteria and viruses, as well as other airborne particles like mold and dust. And then there's source control. So unlike respirators or masks that are used for respiratory protection, source control is designed to reduce the particles Source control is not designed to reduce the particles that the wearer will inhale, but more so designed to block splashes and sprays from entering mucous membranes of others. So a simple way to remember the difference is that respiratory protection protects the wearer and source control protects others. So let's test out this idea. I have a runny nose and a cough, so I wear a mask when I go to the grocery store. What would this be considered? Would this be considered source control, or would this be considered respiratory protection? What do you think? You can use the chat box if you feel comfortable putting your guess. Source control. Source control. Okay, good. Perfect. So we got it. So I don't feel well, so I'm protecting others by putting on a mask. So I'm a nurse and I'm walking into a patient room with chickenpox and I put on an N95. Would that be respiratory protection or would that be source control? Respiratory. Yep, correct. Because I'm protecting myself, I'm protecting the wearer from the person that has chickenpox. Great. So now we're going to move over a little bit into PPE. So personal protective equipment, or PPE, are worn to disrupt the chain of infection. PPE should be selected based on the type of precautions the patient is under and a risk assessment. So staff should always follow standard precautions in addition to any transmission-based precautions when caring for patients. PPE includes gloves, gowns, goggles or face masks, and respirators. Also face shields. I think I failed to mention that one. So PPE is typically donned prior to entering a room and is removed and discarded carefully. Hand hygiene always plays an important role in PPE wear. It's important to clean your hands prior to putting on PPE and then immediately after removing your PPE, cleaning your hands again. So when you are donning or putting on PPE, the order should always go gown, mask or respirator, goggles or face shield, and then gloves. No matter what combination of PPE you're wearing. And gloves are always last because gloves should always go over the cuffs of a gown and not under the cuffs of a gown. So we'll start with gowns. You wear a gown when you're anticipating contact between your clothing or skin to any blood or body fluids. So this includes when contacting non-intact skin, like a wound, during procedures that can cause splashes and sprays, and when handling containers of patient fluids like a Foley or changing a bedpan. A gown should fully cover the wearer's torso down to your knees to the end of your wrists. It should open in the back and fasten twice, once around your neck and then around your waist. So you wear a face mask or a respirator when anticipating any sort of potential splashes and sprays with blood or body fluid, or have a patient with known infectious disease requiring an N95, like tuberculosis, or a mask, like the flu. So I'll now have my colleague Lisa Ledoux come on screen and demonstrate how to put on an N95. There she is. I can see you, Lisa. So first, you'll position the respirator in your hands with nose piece at your fingertips, and you'll cup the respirator, allowing the bands to hang freely below your hands, just like Lisa's doing there. You'll place the respirator under your chin with the nose piece facing up and secure the top strap to rest on the top back of your head. Then you will go ahead and secure the bottom strap, and this will go below your ears on your neck. Perfect. You want to be sure that the straps do not crisscross, just like that. And then you'll use the fingertips of your hands to secure the metal nose clip and slide your hands down and mold the rest of the mask edges to your face. Then Lisa's not going to show us how to do this, but we will perform a user seal check every time we use an N95 respirator. Abby, our colleague, will put the link in the chat on how to perform a user seal check on a respirator. Thank you, Lisa. So here you can see the differences between surgical masks and N95s as respiratory protection. So to summarize this chart, an N95 provides the greatest level of protection, should be fit tested and seal checked tight to the wearer's face, and filters small airborne particles and aerosols. A surgical mask protects against larger splashes and sprays and not against small particles and aerosols. And both ideally should be discarded after use. So then we have goggles and face shields. So you wear goggles and face shields when you're anticipating potential splashes and sprays of blood and body fluid. So you would wear goggles to just protect your eyes. You would wear face shields to protect your face, like your nose, mouth, and eyes. It is important to note that any personal eyeglasses or contact lenses are not considered adequate eye protection. When you're putting on goggles and face shields, it's important that you place over your face and eyes and adjust the band in the back to fit your head. And be sure that all your eye protection doesn't interfere with the fit of other PPE. Say, for instance, if your goggles are knocking into your N95, then you might need a face shield instead of goggles because you don't want to disrupt the effectiveness of your N95 mask. And then there's gloves. So you wear gloves when you're anticipating contact with blood or body substances like fluids or solids, mucous membranes, non-intact skin, or the insertion point, of an invasive indwelling device. When you put on the gloves, make sure that you're selecting the correct type of gloves, whether you need sterile or whether you don't need sterile, and then you select the right size. Clean your hands prior to donning gloves, and then you're going to extend the gloves to cover your wrist and over, again, your isolation gown if you're wearing a gown. So here are some examples of how you would choose PPE based on risk. And this all falls under standard precautions, which we talked about in our last session. So looking at the risk, potential of a procedure or situation, and choosing the infection prevention steps based upon that risk assessment. So let's take a look at some potential scenarios. So first, when you're intubating a patient, you would anticipate close contact with respiratory secretions and particles. Here you would select gloves first to protect your hands, as well as the patient from potential germs on your hands entering their sterile respiratory system. You would select a gown to prevent splashes and sprays from landing on your exposed skin and scrubs. You would also select eye protection, again, to prevent splashes and sprays from landing in your eyes. And then you would select the most appropriate type of mask or respirator. So if there is suspected COVID-19 or other infectious disease requiring an N95, you would don that for maximum protection. And we could do the same process for irrigating a wound or helping a patient back to bed with diarrhea. You'd look at the exposures and choose the appropriate PPE or risk for exposures and choose the appropriate PPE according to the potential for either breathing in particles, splashes and sprays, or contact with infectious materials. So there are a variety of ways to safely remove PPE without contaminating your clothing, skin, or mucous membranes with potentially infectious material. It is important to remove all PPE before exiting the room except a respirator if you're wearing a respirator. Remove the respirator after leaving the patient room and closing the door. It's also important to note that this is routine doffing and does not include detailed doffing procedures for situations like Ebola virus. So we'll go over 2 ways to doff briefly in this webinar. Removal of PPE does vary, and sometimes facilities have a preference, so please be sure that you know the preferred method of your employer. So option 1 is for a tearaway gown, and option 2 is for a reusable gown. So when you're wearing a reusable gown, you remove gloves first, being sure not to contaminate your hands when removing. Then you would remove your face or eye protection, removing from the back tie so you don't touch the contaminated front, and then you remove your gown by undoing the ties and pulling off your gown while folding it inwards towards the contaminated area. And then lastly, you'll remove your respiratory protection. At the end, you will clean your hands. If at any point during the doffing procedure you think that your hands are contaminated, you would stop doffing and you would clean your hands and then proceed with your doffing procedure. And now we are going to go through option 1 in a little bit more detail and with some help from my colleagues. So when you're removing a gown, you want to remember that the most contaminated parts will likely be on the front and sleeves. The outside of your gloves are also going to be contaminated. So now I'll have my colleague Jacob join us on screen to show us proper doffing of a gown and gloves together in that 1-step tearaway method. There is Jacob. Want to make sure I can see you there. So first step, hang on. There we go. First step is to grasp the front of the gown with both hands and pull away from the body. This breaks the ties in the back of the neck and around your waist. There we go. So we remove the gown by folding and rolling the gown into a bundle while simultaneously peeling the gloves off at the same time. You can see Jake doing that. He's rolling it away from his body and he's peeling his gloves off as he's making his gown into a little bundle. Again, this is for the non-reusable, so this is the discarded gowns. And he will throw that away as soon as he's done into a waste container before exiting the room. Thank you, Jacob. So the next step would be to remove your goggles or your face shield. And again, remember that the front is most likely to be contaminated. So you would remove your goggles or face shield from the back by lifting the headband, making sure not to touch the front portion and only holding onto the straps. So it might dangle a little bit in front of you, but make sure that you're not touching any of the front. If the item is reusable, place into a receptacle for reprocessing. Otherwise, you're going to throw the used PPE into a trash container. And last, you will remove your respiratory protection. And I will have Lisa join us one more time to demonstrate how to remove an N95. There she is. Hopefully she wasn't wearing that the whole time. All right. So remember not to touch the front of the respirator because that part is most likely to be contaminated. So to remove, you will either untie the ties or remove the elastic straps at the back, starting with the bottom strap. This will be followed by removing the one at the top without touching the front of that respirator again. So you might get a little bit of a dangle. Be careful if you're wearing glasses like Lisa. Then you either discard the respirator or store it according to facility guidelines. Thank you, Lisa. So again, as I mentioned, respirators and masks should be one-time use. However, if there's a shortage or if there's something going on, you may be asked to use that over again. So make sure you know your facility's guidelines and policies. And our last step after removing any PPE, whether it's a combination of PPE like gown, gloves, and face shield, or just gloves, make sure that you clean your hands with either soap and water or an alcohol-based hand sanitizer. So our key takeaways from today: source control stops germs at the source. Respiratory protection protects the wearer. Source control protects others. PPE is an essential infection control measure that will keep us and our patients safe. Donning and doffing appropriately will help prevent the spread of germs. And hand hygiene plays an important role in PPE use and infection control. So before we wrap up, I would just like to go over certificate of training requirements again. So to receive your certificate of training, be sure that you completed the pre-session survey and attended the live webinar today. Next, you will need to be sure that you complete the post-session survey, which will be emailed tomorrow, September 12th. It closes September 18th at midnight, 1 week from today. The certificate of training will be emailed to you September 21st if all is done correctly. Again, this is for the certificate of training. However, if you're looking to receive a specific CNE credit, you must complete all the requirements that we just talked about previously, plus have attended the session prior, session 1, and complete the requirements for that course as well. For CNE credit to be given, Project Firstline is required to supply a quiz. So be sure that you are, if you're looking to receive that CNE credit, that you complete the post-session quiz that will be emailed to you tomorrow with the rest of your documents as well. And again, if you have any questions about this process, please reach out to our team. We'll be happy to answer any of those questions. If you did not enter your email earlier in the chat, please feel free to enter it now to be added to our distribution list of upcoming trainings. You can also click on our live events link through our website. Abby will post that into the chat box as well. And we'd also love to have you follow us on social media. We have Twitter, Facebook, Instagram, and LinkedIn. So Project Firstline also has 2 upcoming future trainings that we are excited to announce. So our first is going to be Monday, September 25th at 12 noon to 1 p.m. It's a 1-hour session. We are going to be offering CNE credit, and this will be presented by Stephanie Doyle, preventing C. diff infections. Then 2 weeks later, on Monday, October 2nd at 12 noon for 1 hour again, Jacob Peguero will be presenting preventing C. diff infections in Spanish. So if you have any colleagues that would be interested in those trainings, make sure that you share that information with them. It's greatly appreciated. Here are the references for today's presentation. And lastly, I would invite you to please take the 3-question poll on your screen. This helps us to improve our future sessions and assess your learning needs. And on behalf of Project Firstline, we hope to see you all again. Again, I would like to remind you that after this slide, we will have a live Q&A. So if you do have any questions that have been lingering in your mind, please put them in the Q&A box for the live Q&A right after this slide here. So we'll end it here. We're right at time. Again, email us if you have any questions. And I want to thank you again for joining me today. Thanks, everyone.